Treatment foster care it's a type of foster care working with children with elevated needs who have experienced extreme trauma or chronic stress in their life. These children typically have a hard time maintaining in the community, and so a lot of times they're placed in residential care.
Treatment foster care is really important to those kids that in the past would have been institutionalized. They might have been in a residential type setting, which is sometimes necessary to stabilize them. However, long-term research shows that they heal better in the community. They have better outcomes being in a loving home. So while those residential placements are absolutely necessary often to stabilize, the long-term goal always is to have them be successful in the community, and treatment foster care homes help to make that happen.
The children who have come into care have experienced extreme trauma, and sometimes their behaviors in reacting to that trauma is adverse to living in a community. So by experiencing a normalcy within a family, a child is preparing for permanency and returning back home, living in a community, and ultimately having their forever home. And every child deserves the opportunity to have a forever family.
Cornerstones of Care supports our treatment foster care families by providing treatment foster care specialists. These people come to the home once a week or more if needed, and less if needed, to support the parents and any issues they might be having in the home. They also provide case management for the families and the children. They're available on call 24/7 to help address any issues that might exist, and it's just really a team effort.
They get 27 hours of pre-service training, which helps them learn some good skills, as well as ongoing training where they meet with other foster parents, so they get additional support from those other foster parents who are taking the same type of children that they are with the same issues, and so they can help support each other.
I've spoken with a lot of treatment foster care parents through Cornerstones of Care, and they said they have never felt more supported in their years of doing foster care. Many of them have done it for years, and they feel like anything that they might have to address with the children, they're able to because of the supports in place.
Typically, a foster family that is open to just new experiences and really has the openness in their heart and in their home to care for children.
We really need foster parents who are willing to stick with those hard times, because it will get easier. As the trust builds and the relationship builds, those behaviors are going to decrease and it will get easier. So that we just need someone who's got that patience and nurturing and able to provide that structured environment for those children to get them through those times.
A great treatment foster care parent is going to be someone who is patient, compassionate, has some sort of understanding of trauma, and just a commitment to the kids so that they can stay in the community. Oftentimes these might be people who have experienced parenting, but not always, because the training will help them to be ready. But definitely just someone committed to loving the kids and sticking it out with them when things get tough, so that we can see them succeed long term.